what would your one piece of advice for a woman who is navigating through menopause would be?
My
If you have to be.
one is that you don't have to suffer through it. It's not a test of endurance.
Yeah. Yes.
You just have to, these are treatable. You don't have to suffer one day. No, don't let anybody tell you that's normal. It's nothing. Yes, it's common, but it's not normal to be so unwell. And it's easily treatable. Your body's just requesting back what it lost. So you get that help that you need and replace it.
Hi everyone, Smita Ohri and Swati Singh, two women who are really passionate about women's health, the wellness, as well as menopause. And we have our wonderful guest here, Dr. Smita Ohri. And Swati, why don't you introduce Dr. Ohri?
Yeah, it would be my pleasure to introduce you, Dr. Ohri. Guys, meet Dr. Ohri, a woman whose journey is a testament of resilience, courage, unwavering dedication. As a single mom, she has juggled between textbooks, night shifts, teen tantrums, and all while pursuing one of the most demanding careers in the world. Today, she stands as a highly accomplished doctor and a role model, a living example that impossible is just a word.
Thank you.
And her journey reminds us that, resilience and perseverance is like key to success. And success blossoms when passion meets purpose. So, Dr. Ohri, welcome. It's a pleasure to have you. And please tell us a little bit about your journey and how you decided to get into menopause care also.
Well, thank you, Swati. Thank you, Reshma, for having me here. So I'm a board certified physician. I have an MD in OBGYN from India. I have an MD in family medicine. And some of the best journeys start with your own pain, right? So I have a surgical menopause at an early age. And at that time, WHI study had come out and I wasn't on hormones. I suffered a lot through it, insomnia, depression, weight gain, brain fog, you name it, I had it. And then I said, this couldn't be okay, that's so. And I went and found my answers. I went into bioidentical hormone education. I did my fellowship in that, integrative medicine. And then I was director of residency program in Overlook Hospital. Then I moved and started my own journey here in this. I've been serving women's health, longevity medicine, aesthetics for the last 16 years now, very successfully.
Wow.
And this is very inspiring for me to see my women feeling healthy and well.
Yeah.
Yeah.
So, Dr. Ohri, what led you to open the med spa and how is this integrated into women's health?
Very good question. So, health is not only about labs and prescriptions. Women also need to feel confident in their bodies and how they look. And a lot of women, when they go through this premenopause, menopause, they can't even recognize themselves. They find their bodies changing, and confidence is everything. So I started with like balancing the hormones, restoring skin, hair, confidence, mood, your sleep, as well as vitality. So when you feel good about yourself, in every area you show up with a lot of confidence and energy.
Yeah.
So that's what's been happening in my practice. And that's why I think this is not like a matter of vanity. It's like a matter of identity.
Yeah.
So it's important to feel good about yourself.
What would you say are some of the misconceptions that are associated with menopause? Especially we hear so many things, and I feel women really they've not done their research, and probably there is no research. Maybe now we have some. So, what would you like our audience to understand?
There are so many misconceptions, and literally nobody. The fact is that there's a lot of research there. And the fact is also that women go to their OBGYNs and their primary care physicians for answers who have gone through this, the WHI study, which was said that hormones are harmful,
Right.
cause cancer, which has been debunked by now. And actually, the latest study from the cancer research has come up that women who are on hormone replacement therapy are less likely to have cancer of any kind. They live 5 years longer, less likely to have osteoporosis, and less likely to have heart disease and all that stuff. So
Fabulous.
that's the first misconception is that people think I got menopause now, so my life is over or it's just downhill from here, which is not true. It's not the best years of your life are
Right,
ahead of you,
yeah.
if you're taken care of properly. Second thing is that people think that, menopause only means hot flashes and night sweats. I don't have menopause. I'm fine. But menopause is happening inside. The oil that runs your engine is done. And now everything's going to slowly fall apart, like your bones, your brain health, your memory. So it's very important to replace it. We cannot afford not to replace it.
Very true.
Yeah. So those are three things I think about the, cancer, it's causing cancer and all those three things are most
Awesome.
important. Yeah.
Awesome.
And how would you say that now that we maybe say a person like me who's into perimenopausal or menopausal stage, like how would we be able to manage these symptoms? Any tips, any thoughts, ideas?
So, I mean, the first thing is to find you you need to have answers first, your own education. Okay, a lot of times you'll get like roadblocks. You should know yourself and you need to read up on it. You want to find a physician who can help you through it. Theoretical hormones are the best ways because I am maybe you want to find a physician who can understand you and who can help you. I am a little bit of a more boutique practice, more elitist. I do integrative medicine. Probably, everybody can't afford me. So you find your own,
Yep.
through your traditional doctors, you can find, even if they don't do bioidentical, they might do hormone replacement through other things which are safer. And talk about it with your friends, spread the word.
That's,
Yeah,
that's so key.
that's why lifestyle is very, very important. So if you what you do, like magnesium helps you with hot flashes, vitamin D helps you, exercising helps you, and diet and managing your weight. Emotional support is very important. So all those things are really important.
Yeah, that support
Yeah.
from the family
Yeah,
is
absolutely.
yeah. So if I were, I would say 3 years back, if, or maybe even 2 years ago, I did not, if I were to think about menopause, like, and there are so many women like me, if we were in that stage and we wish that there were some things I knew about menopause, what would you advise those such women going in or anticipating menopause or even perimenopause for that matter?
So this is a very, very good question because that's what's happening. People feel like they're being blindsided. Suddenly they feel these feelings of anxiety, insomnia, weight gain, hair loss, like you said about yourself. And suddenly you don't like your husband so much. So, and you don't know what's happening. Everything is fine, but you don't feel good in your skin,
Right.
So this is the one they need to know they're not broken. It's a hormonal change. This is easily fixable. Like I said, talk to your friends, talk to your physicians, get educated about it and don't take no for an answer.
Yes.
That's a good one.
Yeah.
Perfect. I
That's a-
love your answer that don't take no for an answer.
And you
That's
did
what I
not. You did not. And
That's
that's
what-
why I admire you
Yeah.
really for that.
Thank you. Thank
Yeah.
you. That's exactly what I did not take no for an answer. So HRT is a vast question. I don't want you to go into details, but tell us briefly about HRT, hormone replacement therapy, what women should know. Because the first thing that I know is they should not be scared of this. But tell us a little bit about HRT.
Yes. So, if you have the right dose, right person treating you knows good about it, it's very, very safe. And HRT has come a long way from 20 years ago. So before they used to do it by pills. So pills and they were from pregnant horses' urine and they're not identical. They're not bioidentical. They are biosimilar. So, and that anything that you take, especially estrogen and testosterone, if you take it orally, it increases inflammation, it increases clotting factors, can increase your risk. But if you take the same thing parenterally, what that means is through your skin or as a pellet, I put pellets in or under the skin, they are very safe because it's almost as if your body is producing, it's bypassing the liver, so it's not causing the issues. So that's very important for you to know. And all hormones are important. It's not only estrogen, it's progesterone, it's testosterone, which we don't talk about, which is very important for your muscle mass. It's very important for your libido, your confidence.
Libido, yes. Very big one for me too.
Yeah, we'll talk about it later.
Yeah.
We'll get you up and up to speed. So yeah, so that's about I would say.
So another thing is, what changes would you like to have in the society? How would you want us to expect from the medical fraternity in the days to come? What can menopausal women I mean, what would you like to see in the society?
First of all, I want education, like what you're doing, right? You both are laymen. You have gone through your struggles, and you are
Yeah.
even if it's people don't want to listen, you're saying, I'm going to talk about
Yeah,
it. Okay.
That's so true.
So that when somebody else goes through it, sometimes the bulb will go up and say,
Mhm.
oh, I heard her say that. Is it what's happening with me? So that without your knowing, even if they're resistant to it, they have more education. We want more people talking about it.
Right.
Number two, there should not be menopause should not be when women literally comes and cries in a doctor's office, then they start scratching their head and say, what do I do? No, it should be a part of like we talk about pain when people come in, right? Blood pressure. They should be talking to all women. Are you having these symptoms so that they screen them out? Third thing is that in the education, we don't have enough menopause education, hormone replacement. They should be there as well.
Yes.
So all those things are really, really important. I think in the society we should have to make this more. I mean, and also at workplace, we need to have better support.
Yes.
Because we are, we like maternity leave, like menopause should be supported. We are like movers and shakers. We should be supported so that it's makes sense to do that, you know. Yeah.
And it couldn't have been explained like more beautifully like you have done. I mean, I 100% agree with everything you said.
Yeah.
More dialogue, more conversation, more awareness everywhere, in common and in workplace, everywhere.
Yeah.
It's just
Absolutely.
absolutely. So what would your one piece of advice for a woman who is navigating through menopause would be?
My
If you have to give
one is that you don't have to suffer through it. It's not a test of endurance.
Yeah.
Yes.
You just have to, these are treatable. You don't have to suffer one day. No, don't let anybody tell you that's normal. It's nothing. Yes, it's common, but it's not normal to be so unwell. And it's easily treatable. Your body's just requesting back what it lost. So you get that help that you need and replace it and be healthy. Because it's not only hot flashes, night sweats, something is shrinking inside of you.
Right.
And you cannot afford not to replace your hormones.
Yeah, and it's not normal.
Mm.
Don't take no
Yeah.
for an answer.
Yeah.
People saying, dismissing it, just, oh, you are just getting old. No, that's
Yeah.
not
Yeah.
right.
Well, no.
You can.
This is going to be the best time of our lives.
Yes,
Menopause.
like you said.
When you have balanced hormones, your children are grown up, you are wiser, you have money, you can go and conquer the world, you know.
100.
To be, you know, that is the our key to our success in the future.
Yeah, I think what resonated with me, especially in the workplace, we are so powerful in every aspect. And then take a step back in menopause, and that changes our life. I mean, we're all powerful women working in the corporate world. So I completely agree with you. We need to take the reins in our hands, go forward with menopause, attacking it,
Yep.
and coming
And the
to solutions.
menopause itself is not the reason. The reason why people take step back is the brain fog, right?
Completely.
Studies have shown you can have a reduction of your brain volume by 30% in 10 years. And
Oh,
we have
wow.
high risk, at much high risk of Alzheimer's
Yeah.
because our hormones go boom down completely. And then we have nothing to, you know, take care of our organs. Men still have some testosterone even when they're older.
They're lucky.
Yeah, they're lucky that way. So, but we can.
We get that.
We can replace them,
Right.
and we'll be faster and stronger and you know more potent.
Yeah, 1%. Can't agree more.
Right.
Can't agree more.
No, this was so wonderful, Dr. Ohri.
Thank
I mean, your story, it's it's not only a medical advice that you've given, but even your journey, it's very inspiring. And we cannot thank you enough. I mean, you are a testament that motherhood and that passion to work can all be combined and can work together. So thank you so much for your time. You're truly an inspiration to both of us.
100%. Thank you,
you.
Doctor, for your time and your insight. I'm sure all our women, the audience who's listening to us, can gain so much and be aware that menopause is not something to be afraid of. Our doctor is here to help us and guide us through. So thank you so much for your time.